Good afternoon. My name is Rasmussen. I'm a medical student with UAB School of Medicine, and today I would like to perform the head and neck exam on you, if that's okay with you.
Yeah.
All right. And what's your name?
Aaron Roberts.
All right. Thank you, Mr. Aaron Roberts. So pretty much what we're going to be doing is I'm going to be doing a series of tests on your head, eyes, ears, nose, mouth area, and your neck. If at any point you feel uncomfortable or have any questions, feel free to let me know and voice those.
Okay.
All right, so first I'm going to start by just inspecting your head. So you have normal hair distribution and normal scalp, normal skull shape, everything looks pretty normal as far as your head goes. So now we're going to move to your eyes. So we're going to use this little eye chart to test your visual acuity. So if you could hold this in front of your eyes, kind of about at this length, and if you could cover up your right eye for me and try and read the smallest line you can with that left eye.
LTFPH.
All right. Now can you cover up the left eye and do the same thing with the right?
LTFPH.
All right. Thank you very much. Now, for this next part, what I'm going to do is I'm testing various visual fields. So I'm going to ask you to cover up an eye, and I'm going to hold up fingers. And if you could tell me how many fingers I'm holding up.
Okay.
All right. How many?
2.
How many?
2. 1. 2.
All right. Can you cover up your left eye for me?
2. 2. 1. 1.
All right. Thank you very much. So now I'm just going to kind of take a look at the external parts of your eye. So your eyebrows are nice and symmetrical, your eyelids are normal, everything looks like it's pretty normal from the outside. I'm going to kind of widen your eyes with my fingers, if that's okay with you, to take a better look. I'm just going to be looking at the whites of your eyes.
Okay.
Alrighty. Can you look down into the sides? Alright, normal left cornea and sclera, and for your right eye, I'm going to do the same thing. Look down into the sides and up. Alright, and again, right side normal cornea and sclera. And now I'm going to use this pen light, and I'm going to kind of shine it diagonally into your eye, and I'm just looking to see if there are any opacities in the whites of your eye or in your lens.
Okay.
Alright. No opacities on the left side. No opacities on the right side. All right, great. And then now I'm going to check your pupils. So I'm going to kind of shine this light into your eyes and see how your pupil size has changed, just to make sure that they react to light well. So as it is right now, your pupils look normal, symmetrical, same size and shape. So I'm going to shine this light into your left eye. Alright, normal direct and indirect pupillary reaction there from the left side. And for the right side, normal direct and indirect pupillary reaction. That's great. And so now what I'm going to do is I'm going to ask you to follow my finger. I'm just kind of keep your eyes focused on the front of my finger and just move with my finger.
Okay.
Or your eyes, not your head.
Right.
All right. Normal extraocular movements and normal convergence, so that just tells us that the muscles around your eyes are working perfectly. And now I'm going to take this is called an ophthalmoscope, and it's going to help me see the internal structures of your eye, namely things like your macula, the blood vessels inside your eye, and so it should be bright, but it shouldn't be painful. But if at any point you feel uncomfortable, just let me know. And I'm going to start from a distance and then move closer, if that's okay with you. Alright, so the room's pretty dim as it is. If you could keep your eyes focused on the wall or an object behind me. Alright, I'm going to start with your right eye. Move in. Alright. Normal macula and optic disc and normal retinal blood vessels. So I'm going to do your left eye. again, normal macula, optic disc, and retinal blood vessels, so everything looks good. All right. And so that ends our eye exam. So now what I'm going to do is I'm going to take a look at your ears. So from the outside, both of your ears look normal and symmetrical, normal auricles on both sides. And I'm going to take this, and this is again going to help me shine a light inside your ears. It's going to just help me try and see your eardrum and the structures that are behind it.
Okay.
But if you feel uncomfortable, again, just let me know. All right. I'm going to pull on your ear a little bit. All right. Normal tympanic membrane and normal middle ear structures. And then on the left side, again, normal tympanic membrane and ear structures. All right, so now I'm going to perform a series of tests that will help me see how well you hear. So I'm going to kind of stand behind you, and I'll ask you to kind of use your finger to plug one ear, and then I'm going to whisper some letters and numbers behind the other one, and if you could repeat those back to me,
okay,
that would be helpful. All right, could you cover up your right ear for me?
3U1.
All right, could you cover up your left ear for me?
4T2.
All right, thank you. And now what I'm going to do is I'm going to make a noise behind one of your ears, and if you could tell me which ear you hear the noise behind.
Left.
All right.
Right.
Perfect. Thank you. All right. So for this next part of the exam, we're going to be using this. This is called a tuning fork. And in each of the tests, you're going to both feel vibration and you're going to hopefully hear a noise. And so right now, what I'm going to do is I'm going to make this vibrate, and I'm going to put it on top of your head. And if you could tell me where you hear the noise, if you hear it at all, or if you hear it in one or both ears.
Okay. Both ears.
All right, thank you. And now for this next test, I'm going to make it vibrate again, and I'm going to place it behind your ear. And if you could tell me when you no longer hear the noise, and then I'm going to move it and tell me if you hear the noise again.
Okay.
And I'm going to do this for both ears.
Okay.
All right.
Okay. Yes. Yeah.
All right, perfect. Now for your other ear.
Okay. Yes.
All right, perfect. Thank you very much. All right, so now what I'm going to do is I'm going to check your nose. So everything looks normal from the outside, symmetrical nostrils. Could you place your finger over your right nostril for me? Breathe in and out through your left. All right, no left nasal obstruction. Could you cover your left nose for me? Breathe in and out through your right. All right, thank you. That just helps us know that there's not anything clogging your noses, or your nose. So now I'm going to take this and I'm going to just take a peek up into your nose and make sure that everything looks normal from the inside. Again, let me know if you feel uncomfortable. Alright. Normal septum, mucosa, and turbinates on the left side, and now for your right side. Again, normal septum, mucosa, and turbinates. Alright. And so now I'm going to kind of try and take a look inside your mouth. Could you open your mouth up for me? Alright, normal lips, normal teeth, and oral mucosa, normal tongue, normal arches. Could you say ah for me? Alright, thank you. Okay. Normal uvula, normal tonsils, and normal pharynx, so everything looks normal from your mouth. So now I'm moving on to your throat. So just looking at your throat, looks like there are no abnormal lumps or masses or swellings or anything like that in your throat or near your thyroid area, and your anatomical landmarks all appear normal. So what I'm going to do is I'm going to kind of feel along the side of your trachea and just let me know if it's uncomfortable. Alrighty. And now I'm going to try and feel for your thyroid, and so I'm going to stand behind you while I feel the front of your neck.
Okay.
Alrighty, could you move your head down a little bit? Thank you. Alright, can you swallow for me? Alright. And now as I feel your thyroid, just let me know if you feel any tenderness or anything like that. Alright. Normal left and right lobes, no nodules or no abnormalities in your thyroid. And so now for the final part of our exam, I'm going to just feel for various lymph nodes. So if you could lean a little forward for me. Alright. Normal periauricular, normal posterior auricular, normal occipital, normal tonsillar, normal submandibular, and normal submental. Alright, and now for your neck, normal superficial cervical, normal posterior cervical, normal deep cervical, and normal supraclavicular. Alright, Mr. Roberts, this concludes our head and neck exam today. Thank you for working with me. Do you have any questions for me?
No.
Alright, what I'm going to do is I'm going to go talk to my preceptor and we'll get back to you shortly.
Okay. Thank you very much.
Thank you.